next speaker after Julie will be Janice K. Smith, MSSA-LISW. Janice is a social worker at Metro Health. Janice, you can go up to the table. She's a social worker at Metro Health Medical Center. She received her Bachelor's of Science degree in elementary education from Case Western Reserve University in 1979 and a master's degree in social work from Case in 1981. Mrs. Smith has over 23 years experience as a licensed independent social worker at Metro Health Medical Center. She has worked on inpatient units with adult oncology, surgery, and medicine patients and facilitated the breast cancer support group for many years. She has also been a member of the Metro Health Advisory Committee for the Breast Cancer Screening and Outreach Program called BREAST. Additionally, she has been a field instructor for Case Western Reserve University and Cleveland State University graduate social work students. In 1992, she received the Metro Health Social Work Award for Clinical Excellence. Mrs. Smith has been a Kindred Spirit Sickle Cell Advisory Committee member and presented at Sickle Cell conferences for Kindred Spirits and for the Cleveland Council of Black Nurses. Presently, she works with outpatients and is facilitating a new sickle cell support group along with Julianne Busta at Metro Health Medical Center.
I'm Janice Smith, social worker here at Metro Health, and social work matters to our sickle cell patients here at Metro Health. This year happens to be the 175th anniversary of Metro Health. Metro has a very long tradition of caring for patients. I've had several patients say to me that they were born here at Metro Health and remember when it was only one building. It's had a long tradition of caring for patients that are low income, have no income, and patients that are chronically ill. Our social work department is actually the second oldest medical social work department in the country. It was established in 1924 and to take care of chronically ill patients. So we've also had a very long tradition of caring and doing outreach to help patients who are in need. You might wonder why medical social work even began. It started way back then for a lot of the same reasons that it exists today. Patients have difficulty with life issues that may result in having difficulty getting to the hospital for treatment. Those problems often interfere with being able to come to the hospital and see the doctor. What kinds of problems? Well, I don't have to ask. Many of you have experienced a lot of the same kind of problems in terms of being able to get access to the doctor if you were laid off, if you were without insurance. And I'm sure you know plenty of people today who have that concern with the unemployment figures being what they are. I talk to patients every day who are unable to and are concerned, afraid to come to the hospital because they don't know how they'll pay for it. don't know whether they'll be accepted, don't know whether they'll be seen by a doctor. So, Metro has helped patients who are in that situation, and it's part of one of the things that I do is help patients with that problem. Another problem is lack of transportation. Not being able to afford to pay to get on the bus. Or having to come a long distance and take hours in order to accomplish getting to the hospital. Another problem that many of you have faced, and others too, is medication. I talk with patients who are making decisions, do I get my medication or do I buy food? The cost of medications are increasing, and there is help available. How can social worker be helpful in this situation? The problem of access to care. Here at the Metro Health, we have what's called the Community Discount Program, and it's a program for available to those who are residents of the county. It's based on your income, and patients are eligible for help by scheduling an appointment with a financial counselor, providing documentation of your eligibility, and once the interview is completed and you've been assigned what we refer to as a rating, the patients are able to schedule an appointment with the doctor. The discount applies to the cost of the medical doctor visit, the cost of procedures. There's a reduction in the cost of that, and especially in the cost of prescriptions. Metro has several plans where some medications are available for as little as $6. They also have over-the-counter prescriptions, which are available at a very reasonable rate too. Much more reasonable than other places in the community. So it's really worth it to schedule an appointment with a financial counselor and see if you're eligible. Patients who are on Medicare are also eligible for the rating program. Those who have Medicare have a Medicare drug benefit. Sometimes that Medicare drug benefit does not cover a medication that you might have. If that's the case and you are rated, then patients are able to get their medication at the discounted rate. And we were talking about the problem of access to care when transportation is a problem. Metro provides the Metro van, which goes to most Cleveland city zip codes and a number of zip codes in the suburbs. And it is free. You have to have an appointment, but if you schedule an appointment, and you can schedule an appointment as much as a month ahead of time. If they bring you to your appointment, they will also take you home. Given the cost of gas prices, it really can make a difference. A lot of our patients would have no other way of getting there. But in addition to that, there are other things that get in the way. of patients coming to the hospital and being able to get treatment. Some of those include problems with not having food, not having shelter, housing issues, utilities. So difficult personal and family relationships can, having child care concerns, having elder care concerns, not being able to get away. These are things that social work can help with. Perhaps we can brainstorm options that might be available to you and come up with a solution. Social work also connects patients to community resources. The Ohio Department of Job and Family Services, Social Security, hunger centers. There are many resources, and in your folder you'll find what we call a street sheet, which has a number of resources, telephone numbers, addresses, for hunger centers, for tenants' rights organizations, just many options. You may not always know which one would be the best one to fit your situation. You can talk with me about that, or other social workers. The wonderful thing about Metro Health is that there are social workers available to you, inpatient or outpatient. They're and at all the satellite clinics too. And they can help you with a number of issues. I encourage you to seek them out, and you're certainly welcome to call me. Our social work department, which actually is located on this floor, is open, and patients can walk in, and without an appointment, it's free. If you were interested in doing advanced directives, if you have questions about a number of concerns about talking with your doctor, maybe something's happened, been unable to communicate, maybe there's been a misunderstanding. Social worker can often intervene in that situation and help bring some resolution. It's often not clear what the concern may be. Sometimes issues arise when you least expect them, and you don't know who to turn to. I have a voicemail that's available 24/7. You can call my voicemail, leave a message, I'll call you back. Social worker can be a troubleshooter and help you figure out where's the best place to intervene. What can you do? Do we need to contact some others in the community? Do you need some legal assistance? So if you may not have a need at the moment, but when something happens and you're not sure who to turn to, please feel free to give me a call. what's gonna be the next option for where we go from here. As Julie was saying, we thought that it would be very helpful, and I've had patients say to me for many years that they would really like to have a support group. And this year, we actually launched it, as she said, in January. And where we go from here, we want your input and your direction, your suggestions of what you would like to do. With Kincaid's Kindred Spirits, we collaborated to launch this program and also to launch the support group. There was an advisory committee, as well as Dr. Choi and Julie, and Kincaid's Kindred Spirits. So we're excited very much to see you all here today, excited about where this support group can go from here, and the opportunities for advocacy, to see more notice and more attention and more monies begin to flow to help sickle cell patients. Thank you.